Turning points change the course of our lives, whether it's a big decision, overcoming an obstacle or tragedy, or taking a leap of faith. These stories of inspiration and resilience are what Turning Point is all about. Hi, everyone, and welcome to this week's episode of Turning Point. I'm your host, Priya Sam, and this week I have the pleasure of interviewing Dr. Alyson Kelvin. Dr. Kelvin is a scientist at VIDO, the Vaccine and Infectious Disease Organization based at the University of Saskatchewan. She is a virologist who has been working on the evaluation and development of COVID-19 vaccines for Canada. Welcome to Turning Point, Alyson.
Hi, Priya. Thanks for having me.
Yeah, it's so great to have you. I know life has been and continues to be very busy for you since the pandemic started. And I thought it was so interesting that your turning point was actually directly related to COVID-19. So take me back to December 2019 and this moment that really changed everything for you.
Yeah, so it was very, very interesting, I'll have to say. It was over Christmas vacation and 2019, and I just had my family over to Halifax, Nova Scotia for Christmas. And I have 3 sisters and a brother, and most of them were able to come with my parents, and their kids came as well. So what I'm getting at is it was super chaotic. And finally, they had kind of packed up and left. And as much as I love my family, it was nice to have some time on my own. And the second night, after they had left, my husband and I were relaxing, having some wine, watching some movies, but not really flipping through, channels and Netflix. And then, so finally I decided I was going to go to bed, read some beforehand, and, feeling nice and relaxed from the wine that we had drank. And before turning off my light, I checked my email one last time, as most people probably do. And at the top of my inbox was an email from ProMed Mail. And for anybody who doesn't know ProMed Mail, I like to think of it as a social networking service for people who are involved in infectious disease. So researchers, scientists, doctors. And basically what it does through an email service, it sends out an email anytime there is an outbreak of any type of virus or bacterial pathogen or fungus. It sends out an email when it's infected plants or animals. So what I'm saying is actually I get a lot of emails from ProMed Mail every day. But at the top of my inbox on this night was an email that said, undiagnosed pneumonia, Wuhan, China. And being somebody who works on infectious diseases, especially emerging respiratory viruses, so viruses that affect your nose, throat, and lungs, I was intrigued, wanted to know what undiagnosed pneumonia meant. And after reading through the email, it gets quite chilling. It describes about 30 patients who had been hospitalized because of this pneumonia. And they were suspecting it to be viral, but didn't know what virus this was. So these factors together are again quite intriguing. The email goes on to explain that hospitals should be on the lookout for these patients who have this different type of pneumonia, and they suggested to identify them right away and kind of make sure that they didn't come into contact with other patients in the hospitals or healthcare units that they were at. So from this, I was a little bit alarmed. I was thinking 30 people hospitalized. If this were influenza, now we know that severe patients are kind of our mark of, people who are in the hospital are the mark of how severe a virus is going to be. So even though we see a number of hospitalizations, we know that there's kind of something below the surface. I kind of think of this as an iceberg. So the tip of the iceberg are the hospitalizations. Below that is the virus being transmitted throughout the community. So there's a lot more people who have either asymptomatic or mildly symptomatic disease that doesn't require hospitalization. So I was thinking, if 30 people are hospitalized, what does this mean? So my father, David, who has a lab in China, in Guangdong province actually, because he's involved in infectious disease research, I immediately thought of him. I wanted to know if he had heard of anything in regard to this new virus. So I forwarded the email to him. And that was kind of the point where, I had recognized that something was different. Perhaps we needed to look into this more. I don't know if I could have predicted everything that happened after this.
Yeah, this just hearing about this and kind of going back to this moment is really taking me back in time. And I can't imagine, obviously most people have no kind of context or background for any of this. So for you to have felt that chilling feeling that you just described so quickly, that certainly says something. So what was your next step after getting this email?
Yeah, so after I got the email, as I mentioned, I sent it to my father, David. Throughout the next couple days, we had some conversations. I didn't understand how this virus couldn't be identified. Looking at the technology that we had, I was waiting with anticipation to know what was making these people sick. And I contacted some of my other colleagues around the country, including Jason Kindrachuk at the University of Manitoba, Danuta Skronsky, who's part of BC CDC. And I wanted to know if they had heard anything and what they were doing about this. Of course, both of them being top infectious disease scientists had implemented some, surveillance strategies at that point. And then I also contacted VIDO, so the Vaccine Infectious Disease Organization here at the University of Saskatchewan in Saskatoon. I knew of them. They were famous to me because they were the only place in Canada that could work on high containment pathogens such as SARS or MERS coronavirus, which is a cousin of SARS-1 and SARS-2. And also work with non-traditional animal models. So for me in Halifax, I only had a containment level 2, whereas VIDO has a containment level 3. It's important to know that pathogens such as viruses and bacteria are rated on a scale 1 to 4. 1 being, very benign, probably will not make anybody sick unless you're severely immunocompromised, to level 4, which would be if you were to be infected with this, most likely you would not survive. So level 4 is something like Ebola. Level 3 is SARS, SARS-1, SARS-2, MERS, avian influenza. And the level 2 is what I mostly worked on, which would be the regular seasonal influenza viruses. So my lab in Halifax was really a level 2 plus because seasonal influenza viruses can make you quite ill. It kills about 3,000 people in Canada per year. So I had some training with high-level containment viruses, but I didn't have the facility to work on level 3 viruses, and that's really the bridge between level 2 plus and level 3. You need the room that you work in with the viruses to be properly ventilated. You need the whole system to back you up. I didn't have that in Halifax, and actually there are very few around the country, which is one of our shortcomings. So to get to the point, I contacted VIDO knowing that they had what I needed to possibly work on this virus. So I contacted them the first week of January, after I had contacted my other colleagues. And we finally connected the second week of January and started to talked about many things, but of course SARS-CoV-2, which was unnamed at the time, was one of those things that we spoke about. And I talked to the coronavirus expert here at VIDO, who is Daryl Falzerano. And he said at the time he wasn't concerned about the virus. So we joke about this sometimes. And I said, well, I would like to get some studies going. So we started putting a plan in place to get permits, because you need a permit to work on the virus in your institution. You need a permit to actually import it if you don't have it here in Canada. And then we spoke about how I could get to VIDO to start working, and also if they could accommodate ferrets, which seem kind of wild, but ferrets are an interesting animal because they're susceptible to many different human respiratory viruses. And they are a good model for newly emerging viruses because we're able to use them to understand how the virus makes people sick, but also to evaluate new vaccines. So this was a step that I wanted in place so that we could understand the virus and then also start to develop possible vaccines if we needed it for this new virus.
This is so fascinating to just hear about all of this happening in the background, of these kind of different levels of functionality that these different labs have. Your early conversations in January of 2020, when most of us were kind of just starting to hear about this situation, and it was still not really affecting us in North America at that point, and to hear that you were already thinking about working on the virus, vaccines, bringing ferrets into the lab for potential testing. I mean, yeah, wow. So you kind of had an inkling that this had the potential to be something larger. And you were, as you mentioned, in Halifax at the time. So then you had these conversations. You, I think, ended up in Saskatchewan on was it a 2.5 week secondment? And you're still there, right? A year and a half later?
Pretty much, yeah. So we planned to come for, it was about between 2.5 and 3 weeks. Our initial arrival date was the end of February. By the time we were able to get everything in place, accommodations for myself and my team, and also it was interesting because we had just had our first case of SARS-CoV-2 here in Canada, and Dr. Falzerano was able to get a portion of that sample, and he was just able to grow it here in Saskatoon. So it was perfect timing that I came just when all the pieces were in place. And I say that because it really puts into perspective, if we knew about this at the beginning of January, we weren't able to have everything ready to go until the end of February. So that's when my team and I were able to get to Saskatoon. I brought my grad students, Megan Francis, and a technician of mine. And yeah, we got on the plane expecting to be here. I packed a suitcase for 2 weeks. And, at the end of those 2.5 weeks, 3 weeks, the pandemic had been declared, and we were starting to head back. Dalhousie had shut down because of the pandemic. And I thought, how am I going to do my work? I work on this. This is when my job is needed the most. And my place of employment has shut down. So, I got back to Halifax and I visited with my family for a week and then turned right back around and knew that VIDO was the place I had to be if I wanted to get work done on this virus, which I felt was my job. So it's not even so much that, I knew something that everyone else didn't, or, it's more that this is my expertise in my training, and this is when I needed to be able to do the work. So got back on a plane the end of March, and then I never left. So my family packed up the house in August and then came, and now they're here. We have a house, and it's an interesting transition to come here expecting also to be here for a couple months and realize that this is where my work was needed.
when did you know that this was different? Because you were a student, I believe, during the first SARS epidemic, and then you had also worked on H1N1. So when did you know that this was something completely different and much bigger?
Yeah, it's such a good question and interesting, because when I first had that email, it sounded very much to me like it could be a coronavirus or it could be an avian influenza virus. I suppose at that time, I was concerned that there was about 30 people hospitalized. Usually with avian influenza, you don't see that many because the virus doesn't transmit easily from person to person. As the weeks went on in January, I put my grad student Maggie on this project. I called my lab in for a meeting and I said, we're going to try and work on this virus. This was probably mid-January. Maggie, I want you to start collecting all the information that you can, all the news reports, because that's actually what our job is more, waiting for academic publications, scientific publications to come out. It's too slow. We rely a lot on the news, so I put her on that to collect this information. I also told my lab that they needed to step up their biosafety. They needed to make sure that they went back and reviewed all of the regulations and that they were ready, if needed, to work on this virus. So as Maggie was, collecting these news articles, it was really obvious that the case numbers were exploding. And this was different than what we had seen previously with SARS-1, as well as any avian influenza virus. When the H1N1 virus from the 2009 pandemic came out, it was highly transmissible. I think that, we saw similar explosions of case numbers, but we didn't see the associated case fatality rate. So the number of people that were dying from the virus compared to the total number of people infected wasn't as high. And this is possibly due to people have this pre-existing immunity to influenza viruses that maybe offered some protection. Whereas this new virus, we possibly didn't have as much pre-existing immunity to SARS-CoV-2, and the case fatality rate was extremely, much higher than what we saw with H1N1, and that's what Maggie's research initially was coming to the conclusion. So I think by mid-January, towards early end of January, I knew that this wasn't the same, and we did have to, things became very real to that. I think the end of January, maybe January 21st-ish, I traveled to Toronto and from Halifax for a grant meeting. And at that time, I was very aware that, there was this new virus. Perhaps I shouldn't be traveling. I was surprised at my colleagues when I got to the grant meeting that this wasn't the topic on their minds. So I think at that point I knew. And interestingly, this was a grant meeting for the Lung Association of Ontario. So I thought everybody's going to be talking about this, but it actually wasn't on everybody's radar.
Yeah, I mean, at that time, I think so many of us just were thinking this was contained to this small population. I shouldn't say small population, but contained in China. I mean, we hadn't really heard much about a global spread. I mean, I remember in February, I went to Mexico on vacation and I was completely oblivious to, I knew something was going on, but I wasn't worried about going on this trip. And so, it wasn't until March really that workplaces started to shut down in Canada. I remember being told, just take what you need for 2 weeks because the office is closing for 2 weeks. And so it's very interesting to hear that really at the end of January, researchers like yourself really, like, the alarm bells were obviously sounding for you. And you mentioned earlier that your father has a lab in China. And I think early in the pandemic, you had also set up a GoFundMe, right, for PPE in China. So were you getting some information from there as well that kind of led you to know how serious this could be, or this was already?
Yeah, so really, I guess because my father's lab is in Guangdong province, whereas the outbreak really started in Wuhan, that his people who were in China at the time in Guangdong province really weren't experiencing the same level of outbreak. And of course, David wasn't there at the time because he was at home for Christmas. And so he didn't actually have a lot of firsthand information. The more information I had was from one of my colleagues at Dalhousie. He is from Wuhan, and so he was telling us how, his colleagues back in China were running out of PPE, and that, I think it really hit home once they shut down the entire city. That was unprecedented, and everybody says that word too much, but we hadn't seen that for infectious diseases previously in modern history. So at that point, and the reports that were coming in that, the doctors and nurses and medical virologists and virologists were running out of PPE because they had to wear their N95s, they had to wear their full Tyvek suits when they were interacting with the patients. That became a major, source of there needed to be immediate action. If we didn't help them contain the virus, then we were in trouble. And that's what was going through my mind. And that's why we set up the GoFundMe page. I, at the time, was on the executive committee for the Canadian Society for Virology. And we were going back and forth in our Slack channels, kind of early end of January, and talking about what should we do about this. And there was some members brought up perhaps having a session in our next meeting, which wasn't scheduled until June. And I was like, no, we have to do something right now. We are the Canadian Society for Virology. We need to help support our country against this threat. And we need to help our colleagues who are in China. And so that's when CSV and also members at Dalhousie, we put together this GoFundMe page so that we could start to raise money and get the PPE out there. As soon as we had done that, of course, there seemed to be a giant PPE shortage as well in North America. But I really hope that our supplies were able to get to China, but not as fast, I think, as we would have liked.
It's interesting because this topic of PPE early in the pandemic, as we're talking about here, was certainly made a lot of headlines. The shortage of masks, not having as large of a kind of emergency supply as we maybe should have, or that was needed at the time. You also mentioned earlier just how hard it was to find a facility in this country where you could even do the work that you're doing when it comes to vaccines and studying the virus. So, what lessons do you think that as a country, as a government, we need to take from this to make sure that if we're in a situation like this again, we're better prepared?
Yeah, and I think that's so important carrying to the next phase of this pandemic and coming out. There was a lot of amnesia after SARS-1. I think everybody saw that, we survived relatively well. We put in our social and physical distancing measures in 2003 in Toronto. I remember having my graduation ceremony and not being able to shake anybody's hand. So those things worked for that virus, but they didn't work for SARS-CoV-2 because it transmits differently. So I think we need better awareness, better education in our universities as well as the general public. And we need to support, this high containment research, both to understand the pathogenesis or how the viruses make us sick, but also for vaccine development and how we can have countermeasures for these high pathogens of high consequence. Unfortunately, this type of work is very expensive because to do it right, to do it safely, it's going to be expensive. To make vaccines that are highly pure and safe for people to take, that's expensive too. But I think it's in the interest of national security to have these things in place, so we're not relying on other countries to do it for us, so we're not vulnerable. I think we can see it both ways. We'll be domestically vulnerable for issues in society that might come up if our balance goes off. If we have too many people in hospitals, overcrowding, overburdening of the healthcare system, that's a real domestic threat. And then outside of that, once we are domestically weak, we could be seen as vulnerable from possibly other countries. So I think, there's a couple of levels to this, that investing in this technology and this type of work will really keep us safe going forward.
Are there any of those level 4 facilities that you mentioned in Canada?
Yeah, so interestingly, there's one. It's in Winnipeg, and it's our National Microbiology Lab. But it's really hard to access and do work, outside of that. So VIDO is in the process of developing a level 4 laboratory here, which I think is great. And that will be accessible not only to scientists at VIDO, but scientists from all over the country can come and be trained and use the facility. So that's one of the reasons why I was able to come here, is because VIDO has this more of an open door policy. You can be a visiting researcher and you can come use their facilities. You can be trained, which, you can think of people as a resource. And during a pandemic, if you don't have the people who've been trained on these high containment pathogens for years, you have no ability to actually work with the virus or contain it or treat people who are sick. So, on all those levels, it's really important to have facilities that you can train people and do the work, which is was great for me last year. And I think it's great that VIDO's moving towards that. It might be important to invest in other facilities across the country, but at least VIDO offers that place for scientists to go if that doesn't happen.
It must have, from your perspective, obviously you're working on these viruses, on this research all the time, right? This has been your whole career. It must have been just such an interesting time period to see your research and your field of study really appearing in the headlines every day. And I know you've done a lot of interviews, and even just talking to you today, you've done such a great job of simplifying these very complex topics, which I really appreciate, because I think, it's hard for the average person to really understand everything that's going on. So I really appreciate you doing that. But tell me about that experience for you in really seeing other people understand the value of this work that you've been doing for years.
Yeah, it's definitely surreal. I think working on these types of pathogens for so long and not finding people that interested or funders to be that interested. Why would that ever happen? It's horrible to almost be right. And, I think I always say, if I did my job well, we wouldn't be in this situation. But I think it takes the community really to support this type of work. So, definitely surreal and kind of like a dream. Not a good one, a bad one. And I'm looking forward to the day that we can go back to normal, but I hope that people remember that, these are important and that we can keep supporting them without having to be in that emergency situation.
Absolutely. I mean, there's so much to be grateful for in terms of, the research that has been happening, that people like you have been doing all of these years, that have led to us having vaccines in such a short time period, for example. I know we talked about you kind of working with the virus in the lab and doing some of the animal testing. I'm not actually sure if that actually happened, but I know you mentioned it. But can you tell us a little bit more about the actual, what work have you been doing there? Have you been helping develop new vaccines, or kind of testing some of the ones that we're using now?
Yeah, so actually I have two roles. When I started to work here or came here to do my own work in February last year, in August, I actually transitioned to be formally seconded here. And with that, I started taking on roles of which other VIDO scientists would have, because I was one of the only people to be trained with SARS-CoV-2. It worked out really well for both of us. So here I have my own academic projects, which I'm involved in some vaccine evaluation and development, some work trying to understand why the virus is making certain people sick. And then the other part of my role actually is to help people who don't have access to high containment facilities or this type of preclinical work. I help them evaluate, say, their candidate vaccines and therapeutics. So that part, I can't talk about specifics, but it's actually really exciting to have a place where people in Canada, if you don't have this type of facility, but you're expert molecular virologist and can design optimal vaccines, you can send them here to VIDO and we can evaluate them for you. So that's been a real pleasure to move science that isn't mine forward. But aside from that, in my own work, I've involved in some vaccines that were developed by my colleague at Dalhousie. His name is Chris Richardson, as well as a vaccine by Entos Pharmaceuticals. Their vaccine is a DNA-based vaccine, and they're out of Alberta. And their vaccine actually is in phase 1 clinical trials right now. So that's exciting to see. And then for myself, I really became interested as the case numbers started to come in and we started to see where the case fatality rate was. I was interested in why older individuals, especially older males, seemed to be more susceptible to hospitalization and possibly succumbing to the virus. And I felt that it would be key to understand those elements, not only to understand how the virus was working, but would these people need different types of therapeutics like antivirals? Would they need a different type of vaccine? So we started working on that, and what I was able to find is that the work that I did here, that older males, when they're infected with SARS-CoV-2, of course, this isn't a preclinical model, meaning in animal work, but when older males were infected with SARS-CoV-2, they produced more virus. So they had higher levels of virus compared to younger females and younger males. And they also had this associated decreased antiviral response. So we have these immune molecules that are turned on when we're infected with viruses that tell the cell that's infected and also the cells all around it, hello, there's a virus here. You need to put up your shields. You need to not let the virus in if you're uninfected at this point. And then it starts calling your immune cells over to start killing cells that are infected. And what we found is that older males had less of this type of response. It was almost non-existent until day 7, day 14 after being infected, whereas females were, they shot up these genes, had this type of response. day 2 after being challenged with the virus. So, that could be explaining why the males had higher levels of virus and possibly why they get more sick. So, when we think about this, we can think that perhaps we need to give older males antivirals quicker so that they can actually control their levels of SARS-CoV-2, and also be more aware that these males might be shedding more virus. Now, I don't want anyone to feel stigmatized because of this, but it's an important public health measure if you are infected, that to stay home, wash your hands a bit more. So that's some of the work that I've been doing.
Yeah, this is so fascinating. And so much of this research will obviously be useful for any future SARS viruses as well, right?
Yeah, that's right. So I think it's helpful to understand these coronaviruses. Hopefully we don't see another spillover or coronavirus of pandemic potential, but that threat's always there. And I think the more we try to dig into these emerging viruses, the better prepared we'll be for the next one.
Yeah, absolutely. I want to go back actually a little further in your history to kind of your early interest in your field of study. I know we talked about your dad we had a few teasers early on, and about how he does some very similar research to you. You actually spent a lot of your childhood in a lab, right?
Yeah, that's right. And so my parents were both graduate students, and luckily they were also interested in having a family. I think that intersection doesn't happen a lot, because when you're a grad student, you're quite poor and you're busy all the time studying or working in the lab. So I was lucky that, my parents saw this as an opportunity to raise a family, and yes, they had me and 3 other sisters and a brother after. But because of, I think, having not a lot of money for daycare, I was often brought into the lab with my father. Of course, this is back in the 80s. But I was really intrigued by what was happening in the lab. And then also he brought me often he'd teach certain seminars at the University of Toronto where he did his graduate studies. So he'd bring me and I'd sit there coloring while he was in a big dark lecture theater while he was teaching his students. So, those are some of my early memories, and they're good ones, and they always intrigued me. I wanted to be a scientist after those experiences. Of course, as every child does, I changed my mind about 100 times before I got into university. But it's funny that I circled back to that. So yeah, that was kind of how it started for me way back.
That's so fascinating. And I mean, it must be really interesting. I mean, especially right now that both you and your father are, I'm sure, talking about this a lot, sharing information. Has this kind of brought you closer, in the sense that your work is so much a part of what you're both focused on?
So I guess not so much with COVID-19, but when I started to do science at the university level, that's when we had something to talk about. I guess being a teenage girl, you start hating your parents a little bit and you have nothing to talk about, talk about with your father. And so once I started taking science and working in the lab, then I was able to talk to him about something again. And actually, I think that's when it happened. So kind of early 20s, that 19-ish, that I really enjoyed that part of science and having somebody to bounce ideas off of course. Again, he was the first person I thought of when I saw the news about SARS-CoV-2. And it was funny because after I sent that email to him, he kind of brushed it off a bit. And, a couple days went by and I'm like, what about this? What are we going to do about this? But it was just nice to have that person because, the other virologists at Dal, I think not being emerging virus researchers didn't see the threat that it was until probably the end of January. So it's always nice to have someone having your back when you feel like the crazy scientist that's, saying that the volcano that's going to end the world is here.
Well, yeah, no kidding. I mean, this kind of brings me actually to another question. I mean, I know you grew up with this very strong influence and support of being a scientist, but I'm sure it hasn't been easy. You work in a predominantly male dominated field. How has that been for you? And I know you also do work to encourage other girls and women to enter STEM programs as well.
Yeah, I think it's a really important aspect, an important aspect to talk about. As I was moving through, my training as a scientist, I had mostly male mentors, especially my father being one of them, which was great for him, to have him. But I think, when you see yourself in your mentors and, that's what you aspire to be, it's kind of awkward to be a very feminine woman and see yourself having to put on those male shoes and pants, really. So it wasn't always easy. There's daily, reminders of this. At one point, when I had my own lab, I had my new male summer student, and the package arrived, and the person who was delivering the package brought it right to my male student and said, "Here you go, Dr. Kelvin." And, so there's daily reminders. It wasn't, it was that unconscious bias that people have. And it's important that we have, I think, images that aren't that white male image putting forth what scientists should look like. So I think as I navigated through this, and it took a while, I learned that it was really important to be myself. I'm a very strong and opinionated woman, but also I have children and I enjoy being a mother, and I want to carry that through to the people that I interact with on a daily basis. So that perspective, I think, is really important in how I mentor my students and how I approach my science. I always go back to one of my most interesting discoveries, and that's that the lactating mammary gland is susceptible to infection with influenza viruses. And I really don't think that I would have found that out if I hadn't breastfed my own children. Knowing that breastfeeding is hard, it's painful, you get cuts, you're open to infection that way. Whereas, the dogma really in the field was breastfeeding is natural. Breastfeeding, if there was really pathogen transmission between mother and child, then we would have found out about it before now. But the truth is, that's some kind of picture that was created, and it might not exactly be reality. And I think having that perspective, I was able to come up with that really weird and quirky discovery. But when I look at that, I think, there's a lot of opportunities to build on that if we were a bit more open-minded.
And you really just highlighted the importance of having different perspectives and diverse experiences, especially when it comes to research. Like you said, I mean, that's something that maybe, probably a man who has never breastfed anyone would even think to explore. So I really appreciate you saying that. And, I also think there is so much to be said for representation, like you said, for young women, for girls to see themselves in positions like yours. So I just thank you so much for sharing that. I know it's really personal experiences, and thank you for all the work that you do as well. I do want to just kind of come back to your turning point here as we wrap up, because we talked about this email you got that really changed everything for you in December 2019, before, this was still a mysterious illness in Wuhan, China. what would you say has been your biggest learning since that moment?
Oh, yeah. My biggest learning. I guess that we're stronger than I thought that we could be, and we can work together more than I was worried. I was really worried that there was going to be mass panic, and, of course we ran out of toilet paper, but things did calm down, and, I think we saw a lot of good in people. But also that we do need to keep bringing this type of research forward. So kind of two lessons coming out of this is, there is a lot of good in people, and that it's really important. It's all highlighted, everything that we've spoken about, to continue this type of work and educating people, I think, about science, both in school as well as in the general public. So I'm quite committed to that. So I think that before the pandemic, I really had thought that sometimes, you start doubting yourself. Am I crazy to be working on this? Everyone is saying that it's not important, that, we won't have another 1918 influenza pandemic. But I think that, again, this really showed that we need to continue the education, continue the research as well in the emerging virus field, but also how we develop vaccines to protect Canadians. So a bit of two things there for you, but maybe not the most eloquent answer. But that's kind of where I'm at right now.
Yeah, no, absolutely. I mean, I think this really has brought to light exactly what you said there, that this research does need to continue, and that, so many of the things we have right now, like vaccines and some countries, like, we're very fortunate in Canada to sort of be coming out of this. It's only possible because of all of the research and work that's been happening all of these years. So thank you so much for that, Alyson. Thank you for sharing, your experience with this pandemic and also your personal story with us today. I really appreciate it.
No, thanks so much for having me. I'm really honored that you asked me, so thank you.
Oh, thank you again. And we'll definitely keep in touch after this.
Okay, great.
And thanks to all of you for watching and listening. We hope you'll tune in again next week for another episode of Turning Point. And if you enjoyed this episode, don't forget to leave us a review and hit that subscribe button if you're watching on YouTube too. Until next time, take good care of yourselves and of each other.